Good morning and welcome to ITTP COVID-19 International Conference. My name is Uche UZOMA, and today I'll be presenting on a title Factors Associated with Risk Perception and Preventive Behavior Towards COVID-19 Infection Among African Immigrants Attending Religious Fellowships in Kuala Lumpur. I'll be covering introduction, problem statement, significance of the study, objective, study variables, conceptual framework, methodology, data analysis, expected outcome, and references. And for the introduction, uh, this research is being carried out in the present study to identify preventive health behavior against COVID-19 based on the health belief model among African immigrants who are attending religious fellowships in Kuala Lumpur. This study is also aimed to explore the predictors of engaging in preventive behaviors. These predictors could potentially be of great practical importance, and it could help identify high-risk groups and take necessary steps towards improving their health. Infectious diseases can have a huge negative impact both on morbidity and mortality rate of a nation, especially on the inequality. So as a result, the risk perception and preventive behavior to control these infections are very essential for the well-being of the population. Preventive techniques such as quarantine, social distances, isolation of infected people, and contact tracing have shown to be efficient in this epidemic. This according to CDC 2020. The prevalence of COVID-19 is a serious global threat, especially among African immigrants in Kuala Lumpur. The risk perception and preventive behavior on COVID among this group of people is important to determine the extent and the degree to which these African fellowship practice behavioral changes that has been instituted by the health authorities in Malaysia as well as Kuala Lumpur. The problem statements are increased prevalence of COVID-19 infection, population with low social group like who are vulnerable, such as the African immigrants, the limited access to health care on these African immigrants, insufficient data on African immigrants population and their health status. The significance of this study ranges from encouraging African immigrants to seek medical help during this pandemic and also to improve the overall health of the nation. And then community health experts will gain information on African immigrants and know how to schedule help for them. And then it will also assist government to identify the level of risk perception based on the severity of COVID-19 infection. And finally, it will increase preventive behavior among African immigrants. Currently in Malaysia, as of 28th of July, the total new cases of COVID-19 infection is 17,405, and the general accumulated case in Malaysia right now is over a million, and the active cases, the total confirmed cases is about 745,703. The research objective is aimed at determining the factors associated with risk perception and preventive behavior towards COVID-19 infection among African immigrants attending religious fellowship in Kuala Lumpur. The study variables, the DV, which is dependent variable, is preventive behavior, whereas the IV are social demographic data, risk perception, knowledge, and past history. The specific objectives include number one, to describe the preventive behavior against COVID, COVID-19. Number two, to describe the socio-demographic status measured by age, sex, level of education, occupation, and marital status. Number three is to determine the risk perception towards COVID-19 infection. Number four is to determine the level of knowledge towards COVID-19 infection. Number five is to describe the past history of COVID-19 among the participants. Number six, to determine the association between preventive behavior and risk perception, social demographic characteristics, knowledge on COVID, and past history of COVID-19. Number seven is to determine the predictors of preventive behavior. Now, the theoretical framework for this study would be the construct of health belief model, which assumes that the population reacts or they are motivated based on the medium or the extent to which they predict the fear or the risks of an infection. That is the population's behavior in the presence of an infirmity. If they feel that the infection is very severe, they will definitely act accordingly and according to the SOP. They include perceived susceptibility, mean that if they perceive they are vulnerable, they will have to practice preventive behavior. Perceived severity means how severe they view the infection. Perceived benefits are the benefits that they gain after abiding by the rules and regulation. Perceived barrier are the hindrances like shortage of face masks and all that. Self-efficacy is about their confidence level in fighting this infection, and clues to action means all the attributes that propel them to take care of themselves. The conceptual framework is the framework that I'll be using for this research. This is the dependent variable. So the factors and the predictors that will lead to preventive behavior include risk perception, social demographic data, knowledge on COVID-19, past history on COVID-19. Research methodology. Here, the study design will be cross-sectional study. The sampling method will be multi-staged, whereby I will choose 3 African fellowships out of the 10 that are in Kuala Lumpur. And then after that, I will run a simple random sampling. And the sample unit will be African immigrants who fulfill the criteria. Study location will be religious fellowships in Kuala Lumpur. The study population are African immigrants between the ages of 18 to 65. Sampling frame will be all those whose name appear in the list in the eligible African fellowships. The sample calculation, I will use two-proportion sample formula by Lemshaw et al. To determine the actual and the accurate sample for this study. The P1 and the P2 will be used to determine the accuracy. And then the total number of sample that I got was 442 African immigrants. Data collection will be used will be self-administered questionnaire. Section A will be questions on social demographic factors. Section B will be questions on risk perception, preventive behavior, risk perception, knowledge on and past history of COVID-19. Section C will be on preventive behaviors. The data analysis, I will be using SPSS 26 as my statistical analysis. It will cover descriptive analysis, which will consist of frequency percentage, and it will be used to describe preventive behavior, social demographic characteristics, risk perception, level of knowledge, and past history of COVID-19. Then second will be bivariate analysis, whereby I will apply chi-square test to determine the association between preventive behavior and social demographic characteristics, risk perception, level of knowledge, and past history. And finally, I will use multivariate analysis to determine the predictors of preventive behavior against COVID-19 infection. The expected outcome would be that there would be or there is a significant association between preventive behavior and risk perception. social demographic characteristics, knowledge on COVID, past history of COVID-19 among African immigrants attending religious fellowships in Kuala Lumpur. And these are the questionnaires from social demographic characteristic will cover age, sex, level of education, occupation, and marital status. Section B will cover questions from risk perception, knowledge on COVID-19, past history on COVID-19, and then section C will cover questions from preventive behaviors on COVID-19. So that will be end of my presentation. I thanks for listening. Thank you so much.